Hello, my name is Marwan. I'm a clinical lecturer from UMed.
Hi, my name is Luanne. I'm a final year medical student from Luanne.
Hi, my name is Christy. I'm also a final year medical student in UMed.
He's here to treat Rajiv Kedkar, who suffers from a chronic skin condition called psoriasis. And though Rajiv is eager for Dr. Sachin to ease his suffering, he's more than a little unsettled because he knows the cure in this doctor's bag is one that's certain to get under his skin: leeches. Every year, millions of Indians choose not to visit their country's modern medical clinics. Instead, they seek traditional healers like Dr. Sachin, who use leeches as part of an ancient system of medicine called Ayurveda.
I think we are quite an open society, so we'll be welcoming if there is a proven effect to it. The public might be maybe questioning the methods, but if there is a scientific reasoning or scientific explanation and it is proven to be a success, I don't think it will be a difficulty for the public to accept it as a complementary medicine.
The country has a lot of rainforests and stuff, so for sure the people has come across leeches before, and some are very afraid of it, some are okay with it. So in the end, it's also up to the individual's choice. And I think as long as the doctor explain properly, the leech is not going to harm you and stuff like that, maybe they are more acceptable.
I think personally for me, just the sight of leeches makes me extremely uncomfortable. I wouldn't take it. But I know some hospitals have done it already. They actually use some leech therapy. Maybe the more rural district hospitals have done it. Yeah, I mean, Christy has a point. I saw one of our friends, her stories. They used leeches on the therapies. Very uncomfortable looking, very fat leeches.
I have seen also it has been used, if I'm not mistaken, in tertiary hospitals. Yep. So I think it's becoming much popular. So because it has been backed up by a few studies already, so it has been accepted in few centers.
They are the stuff of nightmares. They dwell in filth and feed on decay. But maggots might also be the next thing your doctor pulls out of his medicine bag. Maggots are the larvae of another creature with an image problem, the fly. In nature, flies lay their eggs in rotting flesh, so the maggot hatchlings won't have to stray far to find food. This taste for dead flesh is what makes maggots taboo. But it also makes them perfect for use in medicine. Here in Wichita, Kansas, at the Wesley Medical Center's Midwest Center for Wound Healing, a new patient has come to try maggot therapy for the very first time. Cindy Kennedy suffers from diabetes. 4 months ago, she had an abscess taken from her abdomen that left a gaping wound. Conventional procedures are causing her so much pain that she can't cope. But if the wound is left untreated, infection might spread throughout her body and she could die. The solution? To place hundreds of live maggots into the wound. The secret lies in their eating habits. These maggots eat only dead flesh and leave healthy tissue alone.
Yeah, I'm not too sure how to feel about having worms eat my dead flesh, but from a medical perspective, it makes sense. And actually, I think based off my experience in my ortho SSC, it looks to be quite safe. It's just, I don't know, it's just really uncomfortable to know that there's something just eating away at you, even though you don't really feel it.
I feel like the worst part is you have to leave it in for 2 to 3 days. Can you imagine if the patient shower and then one of them just crawls out? I cannot. I would probably give it to my patient if it's really proven to help, because we are all evidence-based medicine, right? But I'm not going to be the person to do it. I'll ask someone else to do it. I really cannot.
my opinion is, well, even though it is disgusting, but as if it's just proven, so I think we just should go for it. Our objective is just to make sure that the patient is having the best medical attention and the least side effect. Sometimes we do debridement to enhance the tissue repair and all. So I think this is quite the same with the maggot. They will eat some kind of debridement just to enhance the cell, the regeneration. But I would say if there is less side effect with maggot, so why not?
There were legitimate uses for the procedure. It was done oftentimes to alleviate the pressures of internal swelling after a head injury. It was also used to remove bits of bone or blood clots after a severe cranial wound, and was the original method of access to perform lobotomies. But for every justified trepanning, there was a seemingly endless number of frivolous surgeries done. In his 400 BC treatise on wounds of the head, Hippocrates recommended the procedure for any minor bump on the head, or to cure such ills as epilepsy, melancholy, or mental illness. Indeed, many surgeons saw trepanning as a way to release the evil spirits that would cause aberrant behavior. Many researchers have suggested that ancient man may have fashioned the resected discs into amulets to ward off future demonic possessions.
Okay, so this procedure is basically drilling a hole in your skull and leaving it open, exposed to the air and environment around you. So people have been saying it can cure like epilepsy, headaches, and apparently there's this thing called increased consciousness, which I don't know, is it still the same as being high? I don't know. So I read an article, it says that there's a very subtle but definite effect. So I think it really could be a placebo effect. Even like the person who was like practicing it, she was saying that it could be. And I really don't think it is safe to do so. Of course, we do craniotomy and stuff in surgery, but we close it back, right?
I think I would still recommend it for like emergencies. So hematomas, blood in the brain. You want to relieve the pressure. Probably the best way to do it. Like if nothing else works. Yeah.
But would you like close it back afterward, like fill back the hole?
Yeah, of course. That's a given. You don't open a hole and then you leave it there. No such thing.
I know, right?
But I agree with you. In terms of minor ailments, I see less of a use. But this is an interesting one for me because it is one of the first ever like surgical techniques that was invented, and a lot of procedures have like derived from it, come down from it. So yeah, it's always interesting to see where it came from.
Trepanation was done not because of a medical condition, but more into ritual procedure. So regarding the medical condition, yes, they did it, but in terms of 20 trepanation was done, only 5 of it because of medical reason, and the others was just about ritual. And even though there are some what do you call it, no more headache, no more symptoms, but the prognosis after trepanation is about 4 years or 5 years. First of all, yes, sometimes in modern medical also we do take it part of the the cranium, and then most of them will put it back just to release some of the blood or tension. But in some cases also we just don't put it back because of the brain is still edematous. We still keep the part of the brain maybe under the skin or whatever. So when the patient comes back, the brain edema has been resolved, maybe you can put it back.
And so basically what it does, it just burns down, and the heat kind of creates a vacuum, and all the earwax will go up. So at the end, you can open it up and see all the earwax. It's pretty gross, but it's cool at the same time.
So why would somebody want to get this done?
It really helps with like sinus pressure, earwax buildup, swimmer's ear, ringing of the ear, and it just makes you feel better. Makes you feel more clean.
If you ever read the book Bad Science by Ben Goldacre, he actually mentioned there's a bit about ear candling, and he actually did experiments on it. And there are also loads of articles on the internet that show that ear candling isn't really effective. You think about it, right? They're trying to create a suction to suck out the wax from the ear, but when you actually light a candle, it doesn't create any sort of suction at all. the temperature inside it's not even hot enough to melt the wax, because remember earwax adheres quite tightly to the skin, right? It's not even hot enough to melt it. And it can cause additional harm by actually having like wax drip onto your skin, burning you. So it doesn't really work. The wax you see inside, it's there regardless. You know, you just light ear candle, you just leave it there burn, right? You'll still see earwax.
So you say the wax just now that they saw that it was in the video, the brown color one is not earwax.
It's not. It's literally just wax. Yeah.
Okay. Wow.
Yeah. It's a pseudoscience. I think it's
the
been
co- the
explored
colour-
already.
The color.
The color looks the same. Yeah. They're great at doing their jobs. You know. They're great at marketing these products, but it doesn't work. It's not recommended.
Even like when you see doctors, they don't really recommend you to like clean your ears with like Q-tips and stuff, because like technically the earwax is there to protect you. Yeah, unless if really is like the earwax is impacted. But even then, you go to the doctor and ask them to get it out, not go to ear candling.
We have medication that is much more safer for just to remove the earwax. I mean, if there is a effectiveness at some degree, modern medications that have much more effective and much safer rather than doing ear candling.
I feel like before being a medical student, I would be more okay with like herbal remedies. Those stuff are like okay, just like a supplement.
I think the most important is that we know whether this is alternative medicine or complementary medicines. Thank you. Bye.
Bye.